Have you been struggling with chronic back pain for several months or even several years and have recently been diagnosed with a condition known as degenerative disc disease? If so, then it's natural to wonder, is this something that will ever get better? Will I have to live with this pain for the rest of my life? Is surgery my only option? And these are all very valid concerns and very valid thoughts, especially since many doctors might tell you that degenerative disc disease is just a normal part of aging and that there's nothing you can really do about it. They may say that you might need to manage your pain with pills or injections for the rest of your life. Or worse, they may tell you that surgery might be your only option for you to get some form of relief and help you get better. But here's the truth. While degenerative disc disease is in fact related to aging, and as of right now, it is something that cannot be reversed, but it also does not mean that you're necessarily doomed to live with this pain for the rest of your life. In fact, in most cases, it's actually entirely possible to reduce or even eliminate your back pain despite this diagnosis. So in this video, my goal is to show you how it is in fact very possible to live a completely normal active life free from pain, even if your doctors have told you otherwise. So first, what I'm going to do is explain to you what degenerative disc disease actually is, how it develops, and why it causes pain. And then I'll share with you some very important research studies that suggest that the diagnosis, while sounding very serious, may not be as nearly as debilitating as it may seem. And then finally, I'll walk you through the exact tips and strategies that we've used to help some of our very own patients heal and recover from this condition and help them get back to living a very normal life despite their pain and despite their condition. So first off, my name is Dr. Kevin Mao, and together with my wife, Tri Lu, we own and operate Balance and Body Restoration Physical Therapy Massage, which is a clinic located right here in Dublin, California. And every day we help people struggling with chronic and severe lower back pain find natural solutions to their pain without relying on pills or unnecessary surgeries. And our goal with these videos is to share the many lessons we have learned from the past 14 years working with our patients with the hope that this information may help some of you out there who may be in a similar situation as well. So first off, what is degenerative disc disease? So degenerative disc disease refers to the wear and tear of these structures in your spine known as your intervertebral discs. Now, these discs help create a ton of motion within your spine, and they also act a bit of shock absorbers for your spine as well. Now, as we age or as stress continues to build or accumulate on our backs, these discs will at some point start to wear out. And when that happens, the vertebrae in your spine will then start, rubbing against each other, which will over time cause things such as increased friction, which will lead to pain and inflammation, a loss of mobility or range of motion or flexibility of your spine, and also just kind of lead to just general stiffness and general discomfort or tightness. So degenerative disc disease is pretty much just another term for arthritis of your spine. Now, I get it, hearing that your discs are wearing out or knowing that you have arthritis of your spine can really sound very discouraging, especially since there isn't that much we can currently do to reverse this process. Because unlike other conditions such as, knee arthritis or hip arthritis, where people have had good success with treatments such as knee replacements or hip replacements, surgeries to replace or fuse these discs aren't really that effective. And unless you're dealing with extreme leg pain or extreme nerve compression, surgeries for back pain alone often don't work out as well as people would hope, and in many cases can actually make the problems way worse. But here's the thing that most people don't understand. Again, despite how bad this condition sounds and how serious this condition can be, what I want to emphasize is that having this diagnosis of degenerative disc disease doesn't necessarily doom you to a life of pain or disability, and that it is actually very possible to live with this condition and not experience any pain or symptoms. And what I want to do next is to share with you a couple of very important research studies that help us illustrate this point. Okay, so this first study I want to go over is a systematic literature review of imaging features of spinal degeneration in asymptomatic populations. All right, so this is a study from the American Journal of Neuroradiology, and this is a systematic literature review, which means that it is one of the most reliable and considered to be at the highest level of evidence-based research, which means that this information is as good and as reliable as we're ever going to find. And what this study did was compile as much data as they could find from thousands of patients who were either suffering with or without lower back pain, and they did an analysis of all of their findings in terms of their x-ray or their MRI images. So this study analyzed a pool of over 3,000 patients and compared, again, the x-ray and MRI images versus the people that had back pain versus those that did not. And I just want to take one paragraph out of the study just to highlight one of the some of the most important findings in this study. So this systematic review indicates that many imaging findings of degenerative disc disease have a high prevalence among asymptomatic individuals, so people that had no symptoms. All imaging findings examined in this review had an increasing prevalence with increasing age, and some findings were present in nearly 90% of individuals 60 years or older, suggesting that imaging findings of degenerative changes such as disc degeneration, disc signal loss, disc height loss, disc protrusion, and facet arthropathy are generally considered part of the normal aging process rather than pathological processes requiring intervention. The finding that greater than 50% of asymptomatic individuals 30 to 39 years of age have disc degeneration, height loss, or bulging suggests that even in young adults, degenerative changes may be incidental and not causally related to presenting symptoms. The results from this systematic review strongly suggest that when degenerative spine findings are incidentally seen, these findings should be considered as normal age-related changes rather than pathological processes. So what all of this pretty much means is that just seeing signs of degenerative disc disease on an x-ray or an MRI is just a normal part of aging. And more importantly, it's very common to see degenerative changes in people who have no pain or no symptoms whatsoever. So just because an x-ray shows degenerative disc disease, it doesn't mean that degenerative disc disease is the cause of your pain. And what this also means is that there are literally millions of people who walk around each day who have degenerative disc disease yet have no pain and no symptoms. So if you've been told that, degenerative changes are something that you just have to live with or that surgery is your only option, the research suggests that this may not be true at all. And what this also means is that an x-ray or MRI results alone shouldn't dictate what you do in terms of your treatment, because there are just so many other potential factors that are at play, and there are so many other things that you could potentially be doing to relieve your pain that does not involve you requiring to have surgery. Which then leads us to our second study, which is a randomized controlled trial which examined 349 people suffering from chronic back pain. And all participants of the study were considered surgical candidates based on their pain levels and also the presence of degenerative disease on their x-ray and MRI. And these people were split into two different groups, 176 who had surgery and 173 who participated in an intensive rehabilitation program that focused on mobility, strength, and also cognitive behavioral therapy, which is a form of psychotherapy. Now, the first takeaway from this study is that both groups, those who had surgery and those who did rehabilitation, improved dramatically within 2 years. However, the differences in their outcomes were minimal. While surgical patients showed slight improvements in some areas, the results weren't really significant enough to prove that surgery is more effective than a comprehensive intensive rehabilitation program. And the second takeaway is even more remarkable. So nearly 3/4 of the patients who were initially considered surgical candidates were able to avoid surgery for at least 2 years following the intensive rehabilitation program. While some eventually did have to opt for surgery, the results are still really significant, because if you think about it, these weren't just people with minor backaches. These were people who had been recommended for surgery due to severe pain and degenerative disc disease. Yet over half of them, nearly 3/4 of them, were able to avoid surgery altogether by participating in an intensive rehab program. And because when you consider the risks or the costs of surgery, like potential complications, recovery time, on top of the fact that you have someone literally cutting you open and drilling holes into your spine, choosing a conservative approach that doesn't involve surgery just makes a lot more sense at the beginning, especially because of the long-term outcomes of surgery and rehab are almost identical. Now, with that said, it's also important to highlight the fact that the non-surgery group received intensive therapy, which means they had therapy 3 to 5 times a week tailored to their specific needs. And unfortunately, most therapy programs today really fall short of providing the level of care that I feel is needed for optimal recovery. Because from our experience, most patients tell us when they've tried physical therapy, they may only get 1 or 2 sessions per week maximum, and their programs are usually more of a cookie cutter, one size fits all approach instead of the individualized comprehensive care that is usually required. So that means that if you're someone who has tried physical therapy in the past and if it didn't work for you, or that doesn't necessarily mean that surgery is your only option. It could just be that the care that you got just wasn't detailed or comprehensive enough to really give you the best chance of recovery. However, it's been our experience here, just like in the study, that when rehab and therapy is done correctly, it can just be a complete game changer for some people. And not just because of the fact that we can help people avoid surgery, but more importantly, the right therapy provides the potential to help you return to living a much better overall quality of life free of pain despite this condition. Now, while these studies do sound promising, and again, it is absolutely true that having degenerative disc disease doesn't mean you're doomed to a life of pain or disability, we still need to be realistic. Because just because you can live pain free doesn't mean you should ignore or underestimate the severity of this diagnosis. Because everything we said earlier in this video is still true. Because as your spine starts to wear down, it can really start to impact your mobility. And if you don't take proper care of your spine, it can lead to things such as pain and inflammation. For example, I wouldn't recommend jumping straight into trying to run marathons or doing acrobatics or trying to do backflips if you have this condition, as these types of activities obviously put a lot of stress on your spine and require a ton of mobility, which if you force motion on your spine that you don't have, it can start to really aggravate the condition. However, if you are someone who just doesn't want to do anything crazy and just wants to do things normally, and if you just want to be able to just do, simple everyday things such as walking or house chores, gardening, or just taking the grandkids to the park, then I believe that this type of life is absolutely within reach, since these are activities that don't really put too much stress or strain on the spine. And if you can identify the real root causes of your pain while learn to get stronger and more flexible in ways that your body will allow, then this is what it takes to be able to live with this condition and to learn how to work around it instead of being in constant or chronic pain like so many other people are. All right, so what I'm gonna do next is to share with you some real life case studies of people that we've worked with, just so you can get a sense of what could be possible for you. So, for context, all of these patients were in fact diagnosed with degenerative disc disease and were told very similar things by their doctors. They were told that they had to just learn to live with their pain and to accept their condition. They were all referred to pain management for potential spinal injections or painkillers, and they were all told that back surgery was likely to be in their future as well. But the good news is, all of these patients were actually able to heal and they're all thriving today. And it's important to note that each path to recovery was different because no two patients are the same. And even though their symptoms were similar across the board, their overall health, their activity levels, and all of their personal goals were very unique and very different. So let me show you how we use different rehabilitation approaches to help these patients overcome their pain, and just to, again, give you a glimpse of what could potentially be possible for you if you are in a similar situation. All right, so the first case study I want to talk about is Mrs. B. So Mrs. B started working with us several years ago when she had just turned either 60 or 61 years old, and she was in really rough shape when we first started working with her. She just could not stand up straight for more than a couple minutes. She was always stooped over, and every time she tried to stand up straight, she was just met with this sharp, burning, just searing pain that looked like someone was literally stabbing her in a knife. And I remember how much assistance she needed from her husband just to get out of the car, or to get up out of the office chair. And I remember her sharing with me that just trying to cook dinner for her family would leave her bent over in tears by the end of cooking dinner. Now, when she went to the doctor, they told her that she had severe degenerative disc disease and lumbar stenosis, and that she was going to need to have a two-part spinal fusion surgery where they would first have to cut her open from the front of her stomach, drill some screws into her vertebrae, and then flip her over and then fuse the back of her vertebrae. And she said, absolutely not. I am not having that procedure done. But the problem is, every time she would try something like physical therapy or massage or chiropractor, her pain would just get worse. And since none of these alternative therapies were working, this is what caused her to think that maybe her doctors were right and maybe she did need to have surgery after all. However, when we started working with her, we realized right away that the real cause of her pain was not coming from her degenerating discs, but instead it was coming from chronic muscle tightness and chronic muscle inflammation. You see, Mrs. B, before she started working with us, had worked for several years as a secretary. She was sitting a lot at a desk, which meant that she also had a lot of problems in her hips and her knees as well. But since she was the type of person to just kind of push through the pain because she had a high pain tolerance, she just didn't really do much to address these issues at the time. However, the tighter the muscles in her legs became, what started to happen is these muscles started to pull her pelvis forward into a position known as anterior pelvic tilt. And since these muscles started to were so tight, they also started to pull her lower back into a position known as hyperlordosis, which is also known as sway back. And being stuck in this position caused her lower back muscles to essentially get really tight and overworked because they were overcompensating for the tightness of her legs. And this is why she was having trouble standing, and not because of degenerating discs in her back. And we know this because once we were able to effectively release all of the tightness of her leg muscles, this took a ton of pressure off of her back muscles, which meant that Mrs. B was back to standing taller for way longer with way less pain within just a couple of sessions. And then within a couple of months of just continuing to loosen up her legs, as well as to help her build some strength in her hips and also her core, this allowed her to get back to be able to cook dinner for her family. She was going on long walks and she was going on short hikes, and she was even able to get on off the ground to play with her grandkids. And remember that, all this happened just 3 months prior when she was told by her doctors that surgery was going to be her only option. But her problem all along was just simply due to tight leg muscles. And just astounding when you think about it. And the best part is, it's been over 6 years since we started working with her, and we just heard from her recently that she is still doing amazing. Her pain levels are gone, and her quality of life is significantly improved just by identifying her real underlying problem. All right, so the second study I wanted to go over is about Mrs. P. So Mrs. P's situation was a little different from our first patient in that her pain wasn't nearly as severe, but her pain was still very persistent and nagging and really affected her quality of life. She was having a lot of trouble sitting for long stretches of time, which meant she couldn't really travel or go on long road trips. And this is something that she was really looking forward to in her retirement. She also felt a ton of discomfort just doing everyday house chores like, gardening or doing the laundry. And what really frustrated her was the fact that she was always very health conscious. She always exercised, she had a healthy diet, she had always did all the right things, yet still suffered from back pain. Her doctors also diagnosed her with degenerative disc disease, told her it was just a normal part of aging. They suggested that she just learn to live with the pain or just accept the condition, or they offered her a bunch of painkillers or even offered her some spinal injections. And this didn't really sit well with Mrs. P because she knew that pills are just a mask, and she just kind of kept searching for other options. So when we started working with her, initially looking at her X-ray and MRI findings, they honestly looked really good for someone who was just about to turn 70. I'd seen 50 and 55-year-olds with way worse looking MRIs than her, so it really didn't make sense that her pain was only coming from degenerative disc disease. But upon further examination, we quickly discovered that her real issue was coming from very weak core muscles. Now, this initially came as a surprise to Mrs. P because she thought that she'd been strengthening her core all along. She had worked with trainers and even went to a lot of exercise classes at the senior center. But she told me that even when doing these exercises for her core, that she could never really feel her ab muscles activate. And every time she tried, she would start to feel her lower back muscles kick in, which in fact were trying to overcompensate for this lack of ability to activate her core muscles. However, to help her solve this problem, instead of just going through the motions of teaching her the same exercise that she had been taught and the ones that she had been doing all along, our focus instead was on rebuilding the connections between her brain and her core muscles using a method of strength training we call neuromuscular reactivation. And through this style of neuromuscular reactivation, we were able to place a huge emphasis on helping her feel and activate muscles that they just didn't even know existed. And as she learned how to activate her core muscles correctly, her back muscles, which had been so tight for so long, they started to loosen up almost immediately. And that constant nagging pain that plagued her for years was gone within just a couple of sessions. And the best part, once these muscles started to kick in, it really set the stage for even bigger changes. Mrs. P then joined our strength training program for seniors, a program known as Forever Strong, where she was learning how to lift weights or do a full range of body weight functional strength exercises, but to do so very safely, very responsibly. And not only did her muscles get stronger, but she also got stronger bones, stronger joints, and just built a ton of confidence within her body. And just after a year, she's lifting 70 pounds from the ground. She can lift almost 20 pounds over her head, despite the fact she had never really lifted weights before in her life. And most importantly, this newfound strength and confidence has been just life changing. She's traveling all the time. She can lift heavy suitcases and boxes. She's been able to clear out the attic and garage that was just full of junk and boxes for years. Again, she's traveling all over the place with her husband and just feels so confident with her body. And most importantly, she's pain free. She's so active with her granddaughters, age 4 and 6, and just really enjoying her retirement nowadays and living her best life despite this diagnosis of degenerative disc disease. Okay, so let's go into our last case study today. So I want to talk about Mrs. C. So Mrs. C had just turned 80 years old and was struggling with very severe lower back pain and also sciatic nerve pain that was shooting down into her left hip and down into her leg. And she was having a lot of difficulty with almost every single task. She couldn't stand for more than a minute, even while trying to use a walker. She could barely get around the house, and for about 18 months, she was mostly just either sitting in the couch or just bedridden in pain. And Mrs. C had consulted with several spine specialists and surgeons and even pain management doctors over the years, and she had even tried 6 spinal injections for some relief, but none of them was able to really give her some relief. And eventually, her doctors told her that a spinal fusion surgery was likely to be her only option left. However, since Mrs. C had so many other health issues going on, and the fact that her husband had had the same surgery a year ago earlier and didn't really do much for his pain, she wasn't really a good surgical candidate. She was never going to really have surgery. So we really needed to find a way to get her some relief any way possible. And when we asked Mrs. C what she had done for her pain outside of the injections, she said that she didn't really do much. And this is because she was just told to just rest and take things easy. And she thought that if she just kept resting, that at some point the pain would eventually go away. Now, it was true that her pain did go away when she rested. The problem is the more she rested, her muscles started to become very, very weak due to atrophy. And as her muscles got weaker, it then became much harder for her to be able to get upright and move around, because every time she tried to stand or walk, her muscles would just give out and they would get into this really sharp spasm, causing significant pain and tightness, forcing her to have to sit back down or to lie down and rest. And this is what was causing her pain: weak muscles that were giving out whenever she tried to move. However, understanding her pain was coming from weak muscles was a good thing, because this is something that can actually be fixed. And once we focused on strengthening her muscles, particularly her leg muscles, her back started to feel way better almost within a couple of weeks. And because what was happening is that since her leg muscles were so weak, this meant her back had really no foundation to stand on, because the legs are the foundation for the hips, which are the foundation for the spine. And we realized the reason why her back was actually hurting is because they were overcompensating for the weakness of her legs. And within just 6 weeks of doing very basic and very simple leg strengthening and balance exercises, her pain levels dropped by 50%, from a 9 out of 10 to a 4 out of 10. And after those initial 6 weeks, she just kept getting stronger week by week. And she's been working with us for a year now in our Forever Strong program. And now she's able to walk around the house without a walker. She's regained a lot of her independence, which means that she can bathe herself. She can go to the market. She can do grocery shopping with her husband. And she's been able to go on small road trips and vacations with her family. And sure, while these types of activities might not seem like much, it's actually quite a lot. And it's actually quite incredible, considering the fact that over a year ago, she was practically disabled and almost bedridden in pain, and her doctors had all but given up on her. And this is just a very short clip that I want to show you in terms of how far she's gotten. Here's a clip of her doing a 10-pound deadlift exercise with perfect form, zero pain, and just incredible strength for someone who just, a couple of months ago could barely move. All right, so that is it for today's video. This is again a summary of what we can do to help people heal from degenerative disc disease. And just to recap, degenerative disc disease can be a very scary and worrisome diagnosis for those who are struggling with chronic back pain. And while this condition is irreversible in theory, and in some situations surgery is required, however, research and clinical experience tells us a much different story, with the sense that being diagnosed with degenerative disc disease does not doom you to a life of pain and disability, and that there are so many different treatment paths or different options that might be out there for you. And with the right treatment approach that is tailored around your needs and your goals, not only is it possible to eliminate or at least significantly reduce your pain, but it's also possible to get back to living a very active, normal life as long as you stay within the limits of what your body will allow. So thanks again for watching. I hope you found this video helpful. Please feel free, if you did find it helpful, to give us a thumbs up and give us a like, and also subscribe to our channel so you can get more insights that we can teach you to help you manage and heal your back pain and help you get back to living your best life. If you have any personal questions or want personal advice, feel free to reach out to us at balanceandbodyrestoration.com, and you can reach out to us from there. Take care, and again, have a wonderful day.